Hello, my name is Dr. Hillel Mazansky, and my area of expertise is medical hypnotherapy, guided visualization, nutrition, and exercise. Today's health tip is described as weight loss, virtual lap band hypnosis. Now, this band is not playing in Los Angeles tonight, but you will hear all about it. This is very exciting information you're going to hear today. Having been involved with weight reduction and treatment of obesity for many, many years, it has always been a challenge because you get recidivism, patients return to their previous weight, you get the yo-yo dieting, they lose and they gain and lose and gain weight. Years ago, physicians started getting involved with surgical procedures to lose weight. Now, what they used to do in those days, former days, is they used to attach the stomach to the small intestine, or the stomach to the large intestine. And this was fraught with many dangers because the patients would have diarrhea, become dehydrated. They could have, the wound would burst open. They would have deep vein thrombosis in their calves, and a piece of the clot would break off and go to the lungs, causing a pulmonary embolism, and a lot of them died. So the surgeons, in their wisdom, decided to revise the whole type of surgery that they did. Now, basically, it is if you have to reduce the stomach size and you have to prevent the absorption. So they came up with a very novel idea called a lap band. This is a piece of plastic that is placed high up in the stomach and placed around the stomach. By doing this, the stomach can only hold a certain amount of food, the patients feel full, and they lose weight. So, great, but you still have to undergo a surgical procedure and mistakes can happen. Now we have developed a technique of virtual lap band surgery using hypnosis. And folks, this is very, very exciting. Step back a moment. We do not calculate weight anymore in pounds. The medical profession uses BMI, body mass index, which is a mathematical calculation using one's height and weight. A normal BMI is 20 to 25, 25 to 30 is obese, and over 30 is morbidly obese. And those are the cases that are destined to have a lap band procedure. But it is very expensive. Why spend all that money and a chance that the band can come loose? Undergo hypnosis. There are very few of us in the country who do this lap band hypnosis. But as I mentioned before, in a previous life, I had a lot of surgical experience, so I know exactly what has to be done. You take the patient, and through deep hypnosis, you make her or him visualize them going through the whole operative procedure, from the point of being wheeled into the surgical suite, watching as the surgeon does the lap band, the anesthesiologist giving the anesthesia, and we keep on reiterating that they feel no pain. After the virtual lap band has been done, we give them an extensive, nutritious program of food and exercise. Having done obesity work for many years, I've come to the realization that it is no use only treating the patient and let them go. It is imperative for the physician and the patient to interact after the surgery, virtual surgery. Hence, on our website, drmedicalhypnosis.com, there is a weight loss lap band video that you can undergo this yourself by listening to it twice a day. The nutrition is explained to you and the exercise, and then either by telephonic consultation following or via Skype, I keep in touch with my patients. I have done quite a few of these, but I must tell you a very interesting case. I had an individual from a distant land who came to see me because his friend received my health tips. And he was a highly regarded professional in his community, but he was grossly overweight. He underwent the actual lap band surgery and did well. But after a few months, he noticed that he was overeating and he was gaining weight. He returned to his surgeon, who did various x-rays and tests, and found that the band had slipped off completely, so it wasn't functioning there anymore. The patient refused to undergo surgery again. Instead, he came to us. We did the virtual hypnosis on him, the virtual lap band hypnosis, gave him a comprehensive, nutritious program, and I still stay in touch with him once or twice a month. He has lost over 80 pounds. And he was morbidly obese. I think his BMI, if I remember correctly, was about 35. And he's absolutely delighted with the fact. Are there any complications? No. The way it actually works is you know that it's in place, and just before you eat, you close your eyes and visualize the lap band in place. You see that the stomach is small and you feel full quickly, hence the weight loss. But I insist, and I give them different nutritional programs at different times of their journey into losing weight, and different exercises as they lose weight, so we intensify the exercise. Weight loss through virtual lap band hypnosis is going to take off as more and more people have it done, and their friends are going to say, wow, what happened to you? And they'll tell them. So you have the opportunity yourselves, if you need it, not to come and see me. Yes, if you want to, you can. But the video explains it all. The video is at drmedicalhypnosis.com, weight loss virtual lap band hypnosis. I thank you very much for listening to my health tips.